late December 2019, patients presenting with viral pneumonia were reported in Wuhan, China. A novel coronavirus was identified as the ghostly pathogen SARS-CoV-2. On March 11, 2020, the WHO characterized the outbreak as a pandemic. More than 170 million cases have been reported across the world. This epidemic is accompanied by an infodemic. An infodemic is an overabundance of information, some accurate and some not, that occurs during an epidemic, which makes it hard for people to find trustworthy sources and reliable guidance. It also can cause confusion, make people adopt risky behaviors, increase anxiety and stress, and even lead to loss of life. For example, in Iran, 700 people died after drinking methanol to heal COVID-19. This pandemic is a supreme case of something that frightens people and makes them feel like they're losing control of their life, which will make some susceptible to conspiracy theories.
Health literacy can facilitate distinguishing between reliable information and dis- and misinformation. It helps navigating sources of health information and health services and empowers people to make informed health decisions and to practice healthy and protected behaviors in the COVID-19 age. Understanding the role of health literacy in the control of COVID-19 outbreak is vital. Chile is not infodemic-free. Misinformation has been a big issue in this health crisis. In fact, according to this study, this was the most believed and diffused fake news by Chileans. Therefore, it is recognized that managing the infodemic is a crucial part of controlling the pandemic and should be considered a pillar of an integrative approach.
In this sense, WHO has presented a framework for managing infodemics in health emergencies. It contains 50 ideas encompassed in 5 areas of action which should be adapted to each context. Our technological approach takes into account 20 of these ideas within an application based on the Glander-Heisenberg cake model. It considers 4 sources of information represented in layers that explain the flow of information from science to social media. The size of the layers is proportional to the amount of information generated by these 4 groups of actors. The last layer, social media, is the largest one, and where we are most exposed to.
So, if you wear your mask to protect yourself against the pandemic, to do it against infodemic, you shall use eMask. eMask is an app based on APRU 4 pillars to managing infodemic. The first pillar is to facilitate accurate knowledge translation. There will be 3 sections to address this pillar: news, infographics, and report. The first will have the purpose of disseminating news from reliable sources such as WHO, the Ministry of Health, and scientific articles. The infographic section will have educational content on important issues of prevention and fight against the infodemic. Finally, in the report section, people will have a daily update of the statistical status related to the pandemic, which can be seen either at a national level, or at a regional level, or they will be able to choose a city that each user wants to investigate.
The second pillar is knowledge refinements, filtering, and fact-checking. As we saw on the cake model, within each layer, there are knowledge refinement processes such as fact-checking. Our app is focused on the social media layer, so in this section, we analyze viral news, rumors, or articles on the internet and we prove, based on reliable sources, why this is trustworthy information or if it's just fake news. This section can also help people to understand how to verify and find the right information. All of this by only typing the fact-checking section.
Third pillar, to build e-health literacy. In order to improve e-health literacy among eMask users, the app will have 2 sections. First, there is a health glossary. It has 3 parts. The first one is about general health, where you can find understandable explanations about health topics such as common diseases and medical vocabulary. The other one contains Chilean slangs and their proper meaning. And the last one will have all the epidemiological words that are used in all kinds of news and information about COVID-19. The second section is an e-health literacy trivia. You will be able to play while learning about health topics and COVID-19. You can also play against a friend connected to the app to make it funnier.
Fourth pillar, monitoring, epidemiology, infovalence, and social listening. The fourth pillar of infodemic management is the continual monitoring and analysis of data and information exchange pattern on the internet, with the aim of counteracting misinformation, rumors, falsehood, and at the same time had a greater control of the information handled by people. We raised the idea of eMask responding. This section will be available on the Twitter for people to put out their doubts on a tweet with the hashtag #IMASResponded, and our IMAS team will answer them weekly. Besides, there will be a section of COVID-19 related frequently asked questions, so they can get reliable information and quality support.
The cost of creating the application will be $22,400. The dissemination will be free, given by the government. Within the expenses, we will have support, maintenance, and payment of salaries, and the income will be from advertising and micro-donations. As the application becomes viral, new sections could be added according to demand, reaching different countries. We could have great sponsors, ally with more governments and recognized institutions. In addition, new prevalent health problems could be added apart from COVID-19 until it is just one more section of the project. The following are our potential sponsors. It should be mentioned that we will work with government institutions and scientific and educational establishments.
Our plan to measure the impact of the application has several ways. We will use the data of downloads so we can know how many people have had access to the information on it. We will also consider the impact on social media, the tweets that contain the hashtag, how many times the content is shared, and also the amount of followers the app has on its social media. Lastly, the triggers section results will help with analysis of the impact of e-mask on health literacy and how it improves over time, both individually and collectively.
Our app has some limitations. One of these is about internet connection that is really necessary to download, surf, and to keep eMask updated. Furthermore, we can know exactly how much time the COVID-19 pandemic will last. These are the 4 expected challenges of eMask. 1. To have thousands of users. 2. To remain working and be useful even after the pandemic. 3. To keep a regular maintenance schedule. 4. To get more potential partnerships.
In order to impact most tech-deficient communities, we will use the infographics section. Thereby, through the association with health services along Chile, we will physically take the material when they carry out the routine medical visits to the rural areas to be distributed among people.
As we know that the infodemic is a global problem at this very moment, our project must be developed as quickly as possible. This is why our schedule of activity include a time range of 3 months pre-launch. In April 2021, we will define the concept of the application, the design, and the making of a prototype. Subsequently, in May 2021, there will be a small-scale test and development of the application itself. Finally, the official launch of eMask is scheduled for June 21st, 2021. The whole process will be accompanied by permanent dissemination in mass media, advertising in public places, and social media featuring influencers and celebrities. Once the application is launched, it must be updated daily, weekly, and monthly, depending on the sections. Short-term goals of eMask are to go viral and achieve the highest numbers of users, as well as to be constantly updated. The long-term objectives for their part will be adapting to different health problems and answer eMask user questions.
Protecting ourselves from infodemic is an all-of-us task. We must be responsible about the information we share. Remember that the right message at the right time from the right messenger through the right medium can save lives. Misinformation or mixed messages can cost lives.